Hey guys, our today's lecture is about Guyon's canal syndrome. It is also known as ulnar canal syndrome. The ulnar nerve is entrapped in Guyon's canal. The Guyon's canal contents are ulnar nerve and ulnar artery. Basically, as you can see in pic here, we have a transverse carpal ligament, also known as flexor retinaculum. Here we have a Guyon's canal, the ulnar artery and ulnar nerve. The ulnar nerve is also wrapped by another ligament that is known as palmar carpal ligament. It is extension of palmar fascia. It is also known as Wöhler's ligament. Okay guys, so here we have a causes of Guyon's canal syndrome. First one is a Wöhler's ganglion. It is also known as a Wöhler's cyst, palmar cyst. The hook of Hammett is fractured. Ulnar artery thrombosis, muscle hypertrophy, pisiform fracture. These are the causes of Guyon's canal syndrome. The test for the Guyon's canal syndrome is Froment's test, that is positive in case of Guyon's canal syndrome. Now we have compression zones for entrapment or compression of ulnar nerve. There are following symptoms in case of compression of ulnar nerve in compression zones. So first one is pain and paresthesia. If the sensory part of the ulnar nerve is entrapped, it can cause a pain and paresthesia at medial 1.5 digit, claw, fourth and fifth finger. In case of entrapment of motor part of ulnar nerve, okay, the person unable to make a okay sign due to loss of intrinsic muscles, and it can also cause a weak grip. Okay, the weak pinch can also be caused by compression of ulnar nerve due to loss of adductor muscles. Okay, here we have a transverse carpal ligament. It is also known as flexor retinaculum. Palmar carpal ligament, also known as Wöhler's ligament. Here we have a Guyon's canal. Okay, so that one is a ulnar nerve and ulnar artery. Okay, so we have three zones of compressions of our ulnar nerve. The zone 1, as you can see in pic, the in zone 1 the ulnar nerve at the proximal bifurcation near the hook of Hammett is entrapped, so it can cause both motor and superficial paresthesia at hand. In zone 2 you can see the deep motor branch is affected, that can cause the claw of fourth and fifth finger. And in zone 3 there will be a entrapment of superficial sensory branch of ulnar nerve is happened, so there will be a paresthesia at medial 1.5 digit and at hand. Okay, so in pic you can see here we have a Guyon's canal, and that one is a carpal tunnel. Okay, so the Guyon's canal contents the ulnar nerve and ulnar artery. So here we have our today's lecture. I hope you have enjoyed it. Stay tuned with us for further lectures. Thank you.